Okay, so hello everyone and welcome, bienvenidos. My name is Maria Isabel Jimenez. I work at 6th floor PHSR. Am I one of the diversity ambassadors? Gina asked me today to introduce our guest speaker. So I'm from Colombia, moved to the US 16 years ago with my beautiful daughter, who's now a senior at UNC Chapel Hill. So hard to say go Heels, but we try. I started working at Duke 10 years ago. I started with Duke Community Health. So I'm familiar with El Centro Hispano and some of the organizations we are going to learn about today. Duke has been a great place to be, to getting engaged with the community, advance my education. It's like truly like family to me right now. So these diversity lectures are a great thing for me for us to come together to learn about our neighbors and just learn about our community. So I am very excited to introduce to you guys to Mauricio Castro. He's a native of El Salvador in Central America. He came to the USA in 1980 as a result of political persecution due to his stance on social justice. He's an effective facilitator and trainer in the areas of capacity building for nonprofits, as well as providing support and technical assistance to emerging leaders and organizations. He has spent much of his life building bridges between immigrant communities and larger community and has led many initiatives focused on connecting people of multi-faith and multi-racial backgrounds and with local and state agencies. Mr. Castro has served as a co-founder of El Centro Latino in Orange County and the board of directors of El Centro Hispano in Durham, the board of directors of Triangle United Way of Orange County, and he currently works as a professional community organizer and co-founder of Durham-based North Carolina Congress of Latino Organizations, a network of more than 70 organizations across the state. His other passion, I was very surprised, is aviation. He's an aviation enthusiast, a certified pilot, and a business owner and CEO with strong background in electronic science and technology research and development. So a little research going on here too. So welcome, Mauricio.
Thank you. Thank you so much. It's a pleasure to be with you. And in that note that she ended, I'd like to share something with you. Because of my abilities to fly aircrafts, a couple of days ago, I was asked to deliver a generator for the tower control of Fayetteville Airport, which that airport is considered to be a Class C, which has considerate air traffic. And so I was kind of like, thinking through the day yesterday and saying how blessed and lucky I am to be able to contribute in the situation that we're in, and in memory of those who lost their lives. And those that are still suffering, I think that it was a very small token of my part, but nevertheless, it felt really good when I stepped in that cockpit and it was just me and the generator. And as you may know, that airport is being used pretty much for all the different operations to drop assistance and coordination and so on. So it's a very critical place to have, electricity. So I was quite flattered when I was arriving because they told me that the airspace was all mine. And that's very rare. I have to wait my turn. Not, you got to do what they tell you to do. So in any case, let me just briefly tell you a little bit more about my experience with the North Carolina Congress of Latino Organizations so that you understand a little bit more why is it that I know some about health and many other issues. We started in 2001. That's the beginning of this organization. And so the Congress of Latino Organizations is a network of organizations that are mostly Latinos or organizations that are providing services to Latino immigrants. So when we started with zero. It was just the idea, the vision of building a network across the state so that we can communicate and so that we can also work issues that impact the immigrant community. And we set up to go and meet with leaders all across the state and told them what our idea was. And so we use what we call in organizing, a one-on-one or relational meetings. Those are meetings intended to be able to have a sense of what people really care about and what is it that is important to them, what is their passion and so on. And a few years down the road, we were like about 75, 80 organizations. The organization sometimes swells up too, and people tell me, how did that happen? Do you guys get an infection? And I tell them, yes. Because when the topics are so important to the community, everyone comes out of the woodworks. Like when we're dealing with issues that has to do with the opportunities for young, undocumented to be able to go to school and to pay at a in-state tuition level, you know that there is a lot of kids, a lot of young kids today graduating from our high schools that's the end for them in terms of education. Because paying in-state, out-of-state costs a lot of money, and most of these families are already stressed financially. So sending someone to school is another burden that goes into that family. So same thing when we talk about immigration issues, and I'm sure that you probably are not. I will assume, and I don't like to do that, but I don't think that you're not familiar with that idea, right? The immigration, the challenge that we're facing in this nation, that we have been talking about, probably 14 million undocumented living in the US, and we haven't been able to find a way to get that regularized. We have to do that, and we are overdue on that. So that's when this, all other organizations, how we swelled. When something like this happened, we did a campaign a couple of years ago also so that we could be able to get driving permit for people who do not have an immigration status. That also, made us, I think at some point we were counting like 110 organizations that joined the effort. So I have a taste of doing all that stuff, but regularly and normally is about 70, 75 organizations that constantly meet up and strategize together. So a little bit of that, a little more of that on the organization. So some of the areas that we have worked, health. We have been very instrumental in pushing the Department of Health and Human Services so that they can implement Title VI. And are you familiar with Title VI? Okay. No one has clue of what that is? Okay, that's fine. Title VI, it's part of the 1964 law that was passed. This is the time during the civil rights, in which there is a part that is called Title VI, which says that individuals need to communicate with their providers in the language that they understand. And the challenge there is that if you do not comply with Title VI, you can lose your federal funding because this is a federal law. So we must comply. Well, North Carolina was found out of compliance in 2003 or something like that. And one of the things that we began to learn across the state was that people were going to clinics, hospitals, and in some cases we had people that basically were diagnosed wrongly because they did not have interpretation, which is part of that Title VI law, in which you have to provide in order to communicate with your patient and the provider. In some cases, there were people that died also because they were not able to communicate. So as we traveled the state, we started to learn that not even the most basic things existed. And one of those basic things is the following. I'll share it with you. That is part of the 1964. Every health provider that receives federal funding should have visible signs in Spanish. And by the way, Spanish, the reason why North Carolina is mandatory also, and I tell you why. There are some thresholds. And the threshold in both cases have been surpassed. So the state decided, oh, well, we need to do this across the board. There is no reason for us to go any further because it's either 1,000 individuals or 5%. Well, this leads me to a conversation that I was having just before we started. I moved to North Carolina in 1995, so it's been 23 years. And I moved from Boston. And when I came here, I researched and I asked people, so how many Latinos are here? How many are we here? And then the official data said that we were 75,000 souls here, which at that point I believed it because, you know what, the census says, and some other people somewhere out there says that that's the number and that's what is recognized. Well, the reality is that in a few years I began to suspect that that was not the real number. Number one, because I know my culture, my immigrant background and heritage tells me we're highly suspicious about things. Every time we ask our names, we're very suspicious. We have to be sure that this is not going to be used in something that is going to be, working against us. So, you want to know how many we are today? How many? Anyone want to take a wild guess? How many Latinos are known to be in the state of North Carolina? Just a wild guess. Just throw a number so that I take a breather.
It's 100,000.
100,000?
That's what
all right.
he said.
All right, good take. Anybody else?
500,000.
500,000. It's moving up and it's getting warmer.
A million.
You reading my mind? Well, yes, that is the estimate that we have today. But if you go to and look at the data on the census, it will tell you that it's somewhere around 850. Again, this time we got smarter. We started working with hospitals and checking data from school systems and figure out that the number, instead of being like, like 800,050 something, that we were a little bit more than 1 million. So we said, there's no way that number is not correct, because how do you explain the birth rate and all of these other, immigration hasn't stopped. Anybody that tells you that has stopped is basically talking nonsense. That continues to happen. Every time I travel throughout North Carolina, I find out that someone just joined family. So nationally, we are about 55 million souls. So, ladies and gentlemen, this is the 17%. This basically equates to 17% of the population of the U.S. And another thing, we are projected to grow at a rate of about 113, 120% by 2030, 2050. So it's going to be a lot of us. We are already a lot. Sometimes I joke that, when I moved to North Carolina, I live in Chapel Hill, and there were 2 Latino stores here in Durham. So if you wanted to have a tortilla and I was craving them, I had to come here, and sometimes they didn't have. I said, bummer. All right, next trip. I would love to have a better luck. So, how many of you live here in Durham? Okay. When you drive at Chapel Hill or any other areas, Wake Forest, okay. No matter where you go in North Carolina, you will find at least 2 or 3 tiendas, like mini stores, like convenience stores, and probably the same number or more restaurants. So the joke that I make is sometimes, there was a time when I used to walk in North Carolina, and when I saw a Latino, I was like, there you are, awesome. And they thought I was crazy because I was making a big deal out of it. Now it's the opposite. I tell people now, it's like, oh, there you are again. No matter where I go, there they are. All right. So, but that is kind of like the dynamics in terms of growth in population, and is going to continue. So let's talk a little bit here now that we have this information. What is your understanding in terms of the issues in health so far? Health, that most Latino, what is the highest death rate? What causes the death rate, the high death rate for Latinos or Hispanic? By the way, either way you say it, it's okay, except for I normally tell people, call us Hispanic Latinos, Hispanic/Latinos, and I tell you why. Because it's very similar to African Americans. Some people of color don't like to be called African American, and some people want to be called black. We're exactly the same thing. So, Latinos, we tend to think that is more inclusive, okay? Because in our continent, we have other countries that are not necessarily of Hispanic descent, right? Like Brazil, one of the largest countries in Latin America, they're Portuguese. That's their who colonized them. So when we say Hispanic, it basically says, you're not part of this, buddies. You're out. So we're going to have to cut a hole here because, so that's when you are thinking more in an educated and respectful and inclusive way. Some people are really attached to the idea that our heritage is from the motherland of Spain. And so my father was from Spain, and I remember how proud of his heritage he was. But he couldn't save us because when we were at home, we were more Spaniards, behavior-wise, even though that I was born in El Salvador. But as soon as we left the house, we were Salvadorans, mingling with everyone the same way. And so every time we went into the house, it was like, uh-oh, we got to turn the switch now. Because now we don't say nosotros, we say vosotros. And we begin to talk more like the accent that he had. But anyway, so did anybody guess what is the leading cause of death among Latinos in the U.S.? Does anybody know?
Heart disease.
You know, I thought of that. But it's a good guess. It's cancer. The leading cause of death for Latinos. Now, when we talk about health, let's also think about economics. Let's think about that. And here's another number. You know, I don't use numbers much, but in this case, I think I'm doing it because I think it's important to kind of see that. 50% of that 54 million that we're talking about are uninsured, and the majority living under that poverty line also. So that's where you begin to think that's why a lot of these folks don't come to preventive care, and sometimes when they come is when it's a little bit too late, when something has really gone really bad for them in their health, because there was no early detection and there was no, checkups and so on. So then we have other things that are going on in that same area, right? Diabetes. It's now rampant in the Latino immigrant community, no matter where you go. You know, because I also, in my consulting work, I traveled throughout the U.S. As a matter of fact, I just got back a week ago from Arkansas, where I was doing some training for some nonprofits there. And one of the things that I was asking them was that too. I said, like, what's going on? By then, I had been already lucky enough to have met Gina. So I was like, let me toss this out there, see what these guys tell me. And it was not at all a surprise. A lot of the things that we see here are being experienced out there too. So, obesity. This one I'm going to touch it a little bit beyond just what's going on with us here, because there are reasons for that, right? One of them is that those of us who came to the U.S., at least the first 5-6 years, we were very healthy. We were very good in terms of health because we came from not an exercising community, but everything we did was exercise. And I tell you why. We'll go home and eat, and to go and do things, you walked. You didn't get in a car. And we live more outside than indoor. We played outside. We did everything outside. We only came home, to do our homework, to eat, and occasionally if there was a special event in the house, we were there, but soon after that we were out. So there was a lot of exercise, and people did not have cars as much as we do here. It's sometimes crazy in a family, and I'd be the first one to raise my hand on that one. We have a family of 5, my wife, myself, and my 3 kids. And when they come for Thanksgiving, our house looks like a car dealer. Everyone has a car. So that has been removed from us. Also, our eating habits were healthier. Now, when I told you that I was going to take this one even beyond that, is because, have you heard of this, business deals that we did, that we do with different parts of the world? We started out with NAFTA, so-called the free trade agreements. Well, the free trade agreements for us has been one of the worst enemies in terms of health, because a lot of the companies that have gone to do business there have brought bad practices. Like if you drive through San Salvador, the city where I grew up and where my family is, and when I go there, you drive in San Salvador, and there is McDonald's, there is Wendy's, there is Papa John's, there is Domino's. I mean, we are inundated by a lot of the same type of, food chains that we have here that cause obesity and cause a lot of the health problems that we're facing today. So, the reason why I wanted to push it out there is because a lot of our international policies are also impacting our health back home. So we're not escaping staying healthy anymore, not even in our own backyard. Before, we used to. As a matter of fact, one of the big surprises that I had in El Salvador, like about 12 years ago, I had been there like a couple of years before, and I asked my family after we got out of the airport to get some water. And that first time, or that time before, the story that I'm going to tell you, they used to serve you water in this sort of like homemade type of cups that are made out of some kind of a fruit. We call them el guacalito. We drink it. It's almost like, have you seen the coconut, the hard part of the coconut? You can cut it in half and that can be a guacalito right there. That's how we drank water, right? So, a couple of years later, I go back and I ask the same, as soon as you arrive in El Salvador, that 110 degrees hits you. So it's hot. So you need water. So I said, let's stop for water. And you know what my big surprise was? The guacalito had been replaced by this plastic, which becomes handy at this point. And as soon as I saw that, I said, we are in front of an ecological nightmare here. And you know what? My suspicion was right. As we continue to drive, we see all these empty bottles, plastic bottles, everywhere. We saw these cattle that were grazing along the side of the road, eating plastic bags. So, going back to, health, that's how impacted we are being by this. So, there are other things that are also impacting us. And I'm just going to quickly give you something here. Besides those major things that I have mentioned, we also know that Latinos account for almost 25% of all HIV infections. That is kind of scary to us, because there is a lot of that going on. Here's another one. Another one is what I call the invisible disease, and that is mental health. Because when you look at people, it is hard to tell whether they are suffering from any mental health. And the immigrant community today, because of the political environment in which we are living in, especially when we are being called out of being the criminals of the country. Do you remember that message, right? There was someone running that became a president saying that we were criminals. We are probably the cause of every problem in this country, by his account. I don't know what happened to me, because I think that I have contributed more than probably many Americans to the American society in terms of all the work that I have done to improve the lives of different people that otherwise will be left out. But that's how we got labeled. So that, accompanied with a lot of the issues that are going on in the schools, we have reports, I know, of kids being told to go back to their home countries because they have been bringing diseases to the U.S. by teachers. So now I'm not saying every teacher is bad out there, but among us, no matter where you go, there are people who are not doing what they should be doing, but instead of are following this false idea that we are a problem. So mental health for us, I think is one of that invisible illness, because all of this pressure has completely got us from all angles. We are being impacted by the lack of access to health. Many people are not able to drive because their status is not, legal here. The irony of this is that their work is welcome. The food is welcome also. Everything that we do is welcome except for being here without proper documentation. And a lot of time has to do with the fact that we have obsolete immigration policies. You want to know when was the last time that the immigration policies were revised in the U.S.? Way back. It was about 65 years ago. That's when quota systems and so on, there's a lot of things that were put in there. So what that tells you is that, and I said it at a conference in New Orleans, I said, if we give immigration to Mr. Bill Gates, he will have it up and running in less than a year. Because for some reason, businesses are quick to pick up and doing things because they have an interest to have those things going. But for some reasons, our systems that have been established to kind of overlook the well-being of us, which is the government, tend to be very bureaucratic. In order for something to move, it takes forever. And so some of us don't even see things in our own lifetimes. So, again, mental health to us is one of the biggest concerns that we have right now. Not that the other issues are not. Yes, they are. But mental health, because of the state of mind that people are going through right now. Even myself. Because you know what? I am a U.S. citizen. But as a U.S. citizen, I have nothing to prove that I am a U.S. citizen. except for my passport. Except for that. My certificate as a U.S. citizen says in very visible and readable letters, do not copy. So we're not allowed to copy our birth certificate that was given to us when we became U.S. citizen. Anybody's a U.S. citizen here in the group that became?
National size, yeah.
Yeah, so you became naturalized. So it's the other process. You either are born here or you meet the time of being in the system before you can become a full U.S. citizen and so on. So guess what I did? Being in the business that I am in aviation, I didn't want to take any chances. I carry my passport everywhere because I don't want to sleep 3 days in a jail while my wife figures out where I am being held and proves that I'm okay to get out of there. Right? So even I, myself, being a full-blown U.S. citizen, is not exempt to that psychological, emotional impact. You won't believe that sometimes I'm walking, through the airports, and even though that I haven't done anything, I feel this kind of itchiness and uncomfortable feeling. It's just what it is, right? So, I'm going to share a couple of facts with you about Latinos that you can think and reflect and also learn as you go, because we're not pretending to learn everything here in one sitting and so on. Number one, we are people of faith, very, very much into faith. And so one of the things that is interesting about Latinos is that we generally place a great priority on faith than scientific data. Even when something happens with us, the first thing we say, the Lord will provide and the Lord will guide me through this challenge. It's until it hurts deeply that you go to the doctor. You can have something going on, and family plays a big role too, because guess what? When we get sick, it is not the doctor the first one that hears about our problem. It's our family. You know what? I'm having this pain right under the, my ribs. What do you think it is? So we're consulting with our families and so on. I come from a family where there are 4 doctors in my family. So it's so funny that whenever we get together, in the discussions that we have at the table and when we are having a good time, we always going to talk about, you know what, I've been feeling this thing years. So this conversation that, this having fun becomes a consultation. So we do that. So know that people have that background in terms of, believing a lot and they're very committed to faith, and a lot of that is put in there when you feel, sick. Here's another one, and this is no-brainer. I started to talk about that, about the provision of interpretation in at the professional level when we're dealing with patients. Linguistically and culturally, that's something that people always tell me, what's culturally? I tell them, look, there are certain norms culturally that we observe, and we need to be aware of that. So linguistically, we have to be able to know that people will be misdiagnosed or there will be a chance of not having a good communication and being wrong in the conversation when a patient is with a provider. Culturally, same thing. Know that some people probably have never gone to a doctor. There are people here that I have met that they tell me they have came from wherever the country they came from, mostly around North Carolina, are Mexicans, citizens. It's changing though, because many of us are making a great comeback from other states and migrating here. So they are culturally not used to being able to talk openly, just like that about things. You have to kind of easy up before you can talk openly to some Latinos, because they're not used to that kind of stuff. We talked about that Latinos are the highest uninsured group in the U.S., despite of being the first, minority group in terms of population. It was like probably 5-6 years ago that we surpassed the African black, community in the U.S. And if you see the birth rates of different groups, you'll see why. You'll see why. And it's just, you see, let's say, one kid being born of a, let's say, white family versus 7 of Latino. So that ratio over a few years, it's noticeable. I tell people, I go to Immaculate Conception Catholic Church here in Durham. You go to a Spanish Mass there, and I will invite you to just go and check it out just to test my theory here. And the number of kids that you see in that place in both Masses at 1:30 and at 5 p.m. are the 2 Spanish Masses on Sunday. You can see that the grown-ups are completely outnumbered. There's a lot of kids there. So sometimes, when you see this data, I'm like, okay, let's see whether this is making sense. But when you look around, you realize that. Go to a quinceañera or a birthday party. There you see it again. Go to a festival. You'll see it again. So, something that I wanted to do, and I'm going to open it up for questions to you, was to share a few recommendations for you. So we know that cancer is the leading cause, right? We also know that diabetes and obesity is rampant. It's just going up and up and up and up. And that's not even here. It's also back home because of what I was telling you, that all of these food chains that are setting business there. Other companies, instead of doing the right thing, they're dumping toxic materials into our rivers and lakes. And as a result, we have already experienced a number of birth defects on a lot of the kids that are being born because of the water that the mom drank when she was, pregnant, or anything that happened along the way impacts that baby that is coming. So here's the first recommendation in no specific order. I will urge you to listen carefully when you talk to Latino immigrants, when you're dealing with whatever situation that they are consulting with you. Because a lot of times we tend to talk a lot and say very little. Sometimes we tell the story like a movie when it can be just as specific about things. And that's who we are, because we're not constrained about time. In our countries, we never use the word saying time is money, because we don't understand that. To us, it's just time hanging out and all that stuff, and who cares whether it is 10 or 11 p.m. As long as we're having fun, we continue on. So listen carefully, because along the way, you're going to find something that is really giving you the signal of what's going on. So rather than trying to get ahead of the conversation when there is something going on with this person, listen. Something that is kind of a luxury these days, right? Because we tend to be moved fast. The other recommendation is truly find a way to follow and comply with Title VI. It will save you a lot of money because in case that you don't know, there are some already cases being brought up against some hospitals or clinics because of it. So I think we had a case that was really terrible here at Duke Hospitals many years ago about this little girl. Did anybody hear about that or remembers that? It was about this little girl that was being treated for some kind of a, I believe it was some kind of a cancer. There was a procedure done, but the tools were not properly cleaned. They were cleaned with tainted, what do you call? It was a lubricant, right? Yeah, that's right. It was a lubricant, so it was tainted. So that has nothing to do with the fact of complying with Title VI, but it does have with complying with all of the checkups that you need to follow in order to use the materials that you use to disinfect tools, especially when you're going to work. So there was a case of that. In at UNC, there was also another one with a mental health patient. This person killed himself. I knew the family and I know the family. They were not able to diagnose that he was having mental health. He jumped out of one of the buildings that is almost right across the Dean Dome. For those of you who are not allergic to the Dean Dome, where the basketball team plays, the top, she's laughing. It's true. So he jumped right out of that thing and he killed himself. And the hospital had been told that there were some mental issues going on, but I guess they didn't take it seriously or they didn't keep a good eye on this person. And so there was a lawsuit. And like that. Also, don't force the situation. Sometimes we are not ready to say it. Don't force it. It's very unnatural to us. It's not our culture. We like kind of slow pace, so on. So don't force a situation because in any case, you're just going to be going against that cultural norm that people don't want to be pushed, especially if they're already suspicious of something for the systems that they deal with. Utilize professional interpretation. That's a very tricky thing. I don't know what is being used here, but I think I have heard at times that there is a sort of like a telephone system that is being used when someone is not able to communicate. It's good, but it's probably not the best, and I can tell you that for sure because I have been sometimes in cases where the person that is, communicating back and forth culturally is also different. And I tell you where the difference is. Not because I am Latino, that means that I understand fully another Latino. There are Latinos from Argentina. There are Latinos from Chile, Colombia, El Salvador, and all of us have our own little identities in our language and the way we interpret things. I've been caught into that with my Puerto Rican friends when I used to live in Boston. I will say things that they will give me a kind of like a, like, cut it? And I was like, what did I say? And later on they will tell me what was interpreted for someone that is from Puerto Rico. And it was at that time that I felt embarrassed. I was not embarrassed when things were happening, but that's one example of this. Interpretation, you have to also kind of get a little bit of a hang of where is this person from? Because if you bring someone from Spain, my wife deals with that a lot. Because in the school district in Chapel Hill, they get a lot of foreign teachers, and they bring their own style of teaching and their own way of speaking, and so the kids sometimes get confused because they hear all these accents that are different. But the fifth is that I also have learned that there are not enough clinical trials and research about Latinos in the US. That's the reason why we also don't know much about it, because you know what? We are a culture that does not have a great record of the history of our health. Like sometimes people ask me, do you know from the side of your father, what should we look out for you? Because, you know, my doctor, that's what he told me. He says, Mauricio, you know what your father passed away of? What happens and who else? His brothers, sisters. And you know what I do? I said, I don't know. Because it was my father and his two siblings that came to El Salvador when they were teenagers. The rest of the family is on the other side of the ocean. And I have no clue of what happened to them and what kind of things they were dealing health-wise. So we don't have good records. So a lot of times that is important. So how do I reach these people? I think that there are a lot of great community-based organizations, faith-based organizations that could give us the opportunity. I have been a big proponent that we need to do that in order to understand more about the things that are impacting us in the U.S., aside from the limited access to health care because of the status that many of us, or the economic situation that we all live in. So I'm going to kind of stop there, and I want to see whether you have any questions about whether something that I spoke here or something that you've been wondering that has not been included or part of my conversation with you.
Yeah. One of the things that you mentioned was driver's licenses. And how is it, maybe I misunderstood, how is it that you are obtaining driver's licenses in North Carolina for people who are not documented? Is that what you said? You were trying to get people who are undocumented a driver's license?
Yeah.
How does that work?
Through a policy, through a state policy. And by the way, can everybody hear me? Right? It's through policy. There are about 14 states in the U.S. that have implemented a driving permit so that people that do not have a status can be able to drive. And it has to do with safety. Because I am also the one, I've done some lobbying also for this, as I mentioned. When you have people driving without a driving permit or driver's license, it is likely that they don't have insurance. So guess what? When you have an accident with someone like that, a couple of things can happen. Number one, the person is just going to run from the scene because they know that they don't have anything. Secondly, your insurance is going to pay for it because they're not going to be able to get it from the other one because likely they don't have. But the most worrisome also for us has also been the fact that you can have people driving that don't know the rules of the road. And that is, I think, a very scary thing. I have a granddaughter that is 2 years old. And when I drive, I'm always thinking, I hope that I don't have a situation where I have to deal with either someone who's driving under the influence or someone that is, on high speed, driving fast and not insured. So the idea of having that was so that people can also, by having a driving permit, because they don't have the status, they will be able also to access and register and have insurance. So that way everyone is covered.
So how in the current political environment then is that working? Because I would imagine that any community, but particularly a Latino community, would be fearful, given where we are today, if they don't have documented status of coming forward. So it seems like to me that's a great avenue, but it's also raising your hand and saying, deport me at the same time.
You are correct. You are correct. That's what our community also told us. But also, because there are other states that have implemented it and done it, and has not shown to be that, It's the only thing that we can say. It's better for us to be driving with a permit and with insurance than without it. Because you're going to have the knowledge of the roads, that you're going to have also the fact that you have an insured vehicle and you don't have to do anything else except for exchange information, and the insurance companies are going to settle it. So, but that is true. So in a meeting of about 150 leaders from across the state in Winston-Salem a couple of years ago when we launched that campaign, we told them, what's worse? You not having anything, and because you don't have any form of driver's license or any kind of an ID, you are being arrested and then potentially being sent or under proceeding of deportation. So a traffic violation of any sort can put you in the process of deportation. So if you have something like that, the officer is going to say, well, you were going, you were speeding, here's your ticket, you go to court and settle it. So there are all those things, but yes, we were quite concerned about that, but we also were able to convince our community that we were better off like that. Yeah.
I was wondering what you thought of the addition of citizenship questions on the 2020 census, and whether they were. I felt maybe they were put on there to underreport, and that would affect dollars going to certain areas as well as representation in Congress. And what you thought about that?
Yeah. Well, you know what? That is quite scary when you hear it, when you know that it's going to be there. First of all, because you know what? Historically, the census has been completely neutral about sharing or providing any information that is not related to counting how many people we are in this country. Worst part of it is that if we are here and we underreport, the dollars that come to our municipalities are going to be cut. The other one is that people, when that question comes up, they're going to say, oh, no, I'm not going to report myself as part of, I'm not going to get counted. So now, also, you question the timing. It has never been the case throughout the history of the census in this country. The purpose of the census has always been to count people, not to start thinking. Imagine if someone says to you, what is your criminal record when you are doing this thing too? And that's probably coming. That's the problem that we have with certain policies, that when you allow one to happen, it opens the gate for other things to be included. And then things that can be minor can become a real trouble for people. So I completely was not happy with the idea, because fear is already there. Mental health is already there, and it's impacting our kids and our adults alike. Because you won't believe what kids tell you about what they worry about. When you ask a kid, what are your main concerns? And a lot of these kids are saying, my concern is that my mom is not going to come back from work tonight. My concern is that my dad is not going to be here tonight. Or my dad is going to be picked up in the morning. Right? So all of those things are being magnified. And so these questions were completely a big concern to us, and it will be, it will continue to be, because there is no telling what else is in the minds of people that are trying to get this information. But let me tell you, we are a very advanced country, aren't we? Technologically, in every sense. The government knows that we're here. They know. And I tell you why. Because it doesn't matter how you work, you are paying taxes, and there is an address, and there is all of this information. You know we're here. One thing. Secondly, I tell you another one. Do you guys know how many trillions with a T dollars undocumented contribute to Social Security that they never see and never will see? We're talking about trillions. So how is it that we're not talking about that? And I ask people in some places where I have spoken about immigration and so on, I said, if you have a savings account, right? We all have a savings account. You know that you have, let's say, $3,000 in your savings account. And all of a sudden tomorrow you see $3 million here. Wouldn't you ask how those $3 million got there? That's what the Social Security Administration should be doing, saying, where is this money coming from? And let's tell people that these people are contributing to something they're never going to see. Taxes, same thing. It's being paid, but we're not getting any benefits if you don't have a status. Number one, you cannot file taxes. You can file just so that you can prepare for the future if there is a possibility for an immigration to reform to be passed, and to show that you are, being in good faith, paying your responsibilities. But we have been paying taxes from the moment that you buy gas, from the moment that you go and buy food, from the moment that you go to work, even though that is not being reported for someone that is, lawfully in this country, but is being paid. So that conversation is not happening. The conversation that is happening is we're criminals. We're bad people. So those are kind of the things that we are dealing with. Any other question? So if you don't have any questions, the only thing that I can tell you is that let's say with what's going on right now with the victims of the hurricane and the rains that we had, in terms of health, one of the concerns that I have always had is epidemics. Communities that don't have access to health care are putting all of us in danger. Because remember that time when there was the avian flu epidemic that hit the U.S. years ago? We were arguing at the state level about the fact that needed to be taken with high level of responsibility to check people and test people and check and make sure that was under control. Some of you probably weren't here when we also had a rubella outbreak. That was like about 11 years or 12 years ago. And the health departments were reluctant to admit that it was an epidemic. So that, to me, I think is a little bit irresponsible, to allow certain things to grow and pretend that they're not there when it is putting all of us in danger. And in that case, rubella, for those who are in the medical field, I only hear the conversation from my family doctors and so on, but I do know a lot about these things because I have learned and trained myself, because I have to be knowledgeable. It affects women that are pregnant. It will cause a baby to have a high probability of being born with birth defects. So it doesn't really do much to me as an adult or someone who's not pregnant, but someone who's pregnant is in high danger to having, a kid in that, with a lot of health conditions and so on. So all of that has to do with the well-being of one community, no matter what. And I think that's a good example of how we can be able to, or how we can become more proactive in how we deal with health services for immigrant communities, not just the Latino community.
Groups from all these different countries, they Is this on?
There you go.
Do you find groups from these different countries all live together? Because, as you're saying, we know that they have cultural differences from Argentina to Mexico, right? So, but would you find Mexicans and Argentinians living in the same area, or do they orient to?
Let's see if I get the question correctly. We mingle. And we're like in Durham. We have Argentinians, Colombians, and we enjoy, salsa dancing. And we eat. We love their food. They love our food. Everybody loves all kinds of things. So we mingle. We do all those things. So I don't know if that is what you were asking. But families tend to live with families. Like when my family came to the U.S., right? My cousins, when they came here, which I have a lot of them in Boston, they came to live with me first. And then, they formed their families, and some, like I know one of my cousin is married to a fellow Mexican gentleman, which is really nice. I love him. He's a really great guy, and so on. And so I'm like, he and she gets the benefit of eating the true Mexican food, and he gets the benefit of eating the true Salvadoran food. And when it comes to celebrations and so on, like at church, we are mingling just like, we just know, like when someone speaks, I can tell where people are generally from, not 100%, but I can tell. And one of the things as an organizer that I have learned is never to assume things. So instead of asking someone, you're from Puerto Rico, right? I say, where are you from? Because chances are it may be from neighboring islands that have similar accent, and I'd be wrong. And so, but that's what happens. Yeah, we mingle. Yeah. So I guess we have reached our time. But, if informally we want to have a conversation, I will be available and more than happy to hang out with you guys. So I just want to thank you, and I want to thank those who are watching us from afar also, and hope that the information that I share and the questions that we had here are useful to your careers and professional, work in health. So thank you so much for having me.